anterior or only posterior, it's combined. Okay. So posterior, anterior, from the posterior towards the anterior direction and from anterior towards the posterior direction, the X-rays will be passing. Okay. How they are passing, we will look over here. So this is the X-ray plate over here. Okay, getting it over? The X-rays will be hitting this part. This plate will be hit by the X-rays after crossing through the body over here. Getting it over? So you can see that the X-rays are passing all the way from dorsum or posterior aspect of the body towards the anterior aspect of the body over here. Okay, with respect to the only body. Getting it over? And the X-ray will be formed over here in this region. Okay, so you can see that PA projection of the chest. Central ray enters posterior aspect and exits on the anterior aspect. Okay, patient is in upright posture. Okay. So in case of, for example, if a patient met with an accident somewhere or something like that, okay, the patient can't able to stand or sit like this. Okay. So at that time we can take the antero-posterior view. Get it or not? So in case of any fractures of the ribs, or if the patient can't able to get up or sit up, if he can't able to sit or stand, so we can take the antero-posterior view X-rays. Okay, if he lies on his bed with the face towards the roof and back towards the floor, so this is the antero-posterior view. If the patient is standing exactly in the opposite direction, if the chest is over this side and back is over this side, this will become anterior-posterior view. Okay, getting it on? If the chest is over here and the back is over here, the same X-ray plate will be there over here, but the X-rays will be passing from anterior towards the posterior direction over here. That is anterior-posterior view, and actually this is posterior-anterior view. Understood or not? Right? How the X-rays are passing. Okay. So you already know that how the tissues will be giving the color within the X-ray place. Is it or not? So you can see that. So this is the postero-anterior view of the thorax over here. Okay, what is this? If somebody gives you the X-ray plate and asks you to describe this X-ray, you have to say 3 points. Okay, one is the view, and one is the region, and whether it is contrast X-ray or not. Okay. Contrast X-ray or plain X-ray means plain X-ray, no dye will be used. For example, if they are injecting a dye through a vein, for example, okay, the vein will be carrying the dye through the subclavian vein, and then it is into the brachiocephalic vein, and then it is into the superior vena cava. So this entire venous thing will be seen over here. Okay, just like this whitish region over here. The vein also will be clearly seen. Okay, so we can expect the brachiocephalic vein over here, subclavian vein over here, but you can't be able to see those veins over here. Is it alright? So here no dye has been used, so it is a plain X-ray over here. If any dye is used, so that the blood vessels or any other structure getting filled up with the dye, so that we can see okay, so that we can see the passage of the dye. Indirectly we can see the veins over here, but we can't able to see any veins over here. Okay, so it is a plain X-ray and belongs to the thorax region. It's not abdomen, it's not the superior extremity or inferior extremity. It belongs to the thoracic region over here. Okay, and the view is postero-anterior view. Get it on? So if an X-ray is given like this in this manner, you have to describe in this manner. So the X-ray given here is belongs to the thoracic region, postero-anterior view, and a plain X-ray. Okay, 3 points you have to mention. Okay, whenever you are asked to describe the X-ray. Okay, and what we are going to see within the X-rays in case of thorax. Okay. I'll show you the difference between anteroposterior and posterior view later on. Okay, first of all, you have to identify the solid structures, nothing but the bones, which are nothing but the ribs in case of thorax. And of course the vertebrae also. Okay, these things you are supposed to identify. If you identify the normal structures, then only you can identify the abnormal structures, like fracture of the ribs. Getting it or not? Right? So first of all, Let us see the rib impressions over here. Ribs appear whitish in color because X-ray can't penetrate the ribs. Is it or not? Last time I have discussed with you. Okay. Ribs or any bony structure is a solid structure, so X-rays can't pass through the ribs. That's why they appear whitish in color. Getting it or not? So if a person is standing over here, for example, look at my hand. So the light is not passing through my hand over here. Okay, the same shadow is displaying over here. Exactly in the same manner, the ribs will be displayed over here. Getting it or not? But the lungs will be carrying the X-rays through and through. That means the X-rays can penetrate through the lungs. Getting it or not? And air can't be stopping the X-rays over here. Okay, X-rays will be passing from that direction to this direction over here. So that's why the lungs appear blackish in color. Getting it or not? Lungs is filled with the air, so the air can't stop the X-rays over here, or the lungs tissue is very much soft, so it can't stop the X-rays. So the X-rays will be passing so that it appears blackish in color. Getting it or not? But for example, if you take the most structured skin is there over here. It's okay. I'll show you the skin later on. Okay. In other X-rays, I will show you the skin how it will be displayed over here. Okay. But now the lungs appears blackish in color because it is filled with the air. But the bones appears whitish in color because X-rays can't penetrate the bones over here. Getting it or not? Right. Again, you can see the vertebrae also clearly, and you can see this cartilage in between these two. Nothing but the intervertebral disc is made up of cartilage, fibrocartilage. So that will also be carrying the X-rays. It is not a solid structure. It is a semi-solid structure. So it will be carrying the X-rays over here. You can see the difference between this dark color and this dark color. But you able to see that? This is more darker in color compared to this one. This is grayish in color. Getting it or not? Right? So this can be carrying the X-rays, but to some extent. That means few X-rays will be passing and few X-rays will not be passing over here, because it is a semi-solid structure. But lungs will be carrying all the X-rays, so it appears blackish in color. And bones not carrying the X-rays, so obviously whitish in color. Okay. Skin also appear in this manner, and fat also appears in this manner. Wherever the skin is present or fat is present. Getting it on? Okay. Let us see the ribs first of all. You can understand. This is the clavicle. You able to see that? This is the clavicle on the left side. This is the clavicle on the right side. Okay. So where can you expect the first rib over here? See here, because it is a PA view, the posterior aspects of the ribs are most prominently displayed compared to the anterior aspect of the ribs. Could you able to see this? Yes. This is one rib and this is another rib. Could you able to see that? This is one rib impression and this is another rib impression. Right? So because it is carrying from posterior to anterior direction, these are more pronounced. The posterior aspect of the ribs is more pronounced compared to the anterior aspect of the ribs. Getting it on? So, how we count the ribs first of all? See here, you can see a C-shaped structure over here. Could you able to see that? It is directed in this manner. Another rib is directed in this manner. Another rib in this manner. Another rib in this manner. This one and this one. This one. Getting it on? So these are the anteriorly directed ribs. Whenever you get a doubt among these two, which one is anterior, which one is posterior. First of all, look at the first rib. So based on this curvature, you can draw the other ribs over here. Could you able to see that? This curvature. Okay. So if this is the curvature, this is the anterior aspect of the first rib, this is the posterior aspect of the first rib. So this is the, for example, this is the second rib. This part is the anterior aspect, this part will be the posterior aspect. Getting it on? So any other rib, this is the anterior aspect and this will be the posterior aspect of the rib. Getting it on? Right? So let us count the ribs over here first of all. So this is the first rib, here will be the second rib. Is it not? Second rib. Then third, fourth, fifth rib over here. Could you understand? And then sixth rib over here and seventh rib over here. So in the fifth intercostal space, just below the fifth rib, we can expect the apex of the heart. Is it not? So let us count again. 1, 2, 3, 4 and fifth rib. And this space is the fifth intercostal space where you can get the apex over here. Could you see that? Right? So obviously apex is directed downwards, forwards and to the left. Is it not? So this part is apex of the heart, which is lying within the fifth intercostal space over here. Okay. Got it? Right? So in this manner, you have to count the ribs over here. Focus on the first rib, then onward, second, third, fourth, fifth, sixth, and seventh, like that. Okay. But in case of gross anatomy, that means the human body, you can count it from sternal angle. Okay. In the X-rays, you can count it from the first rib, but in case of gross anatomy, you can count it from the sternal angle, second rib onwards. Okay. Let us see the vertebral. You can appreciate clearly this is a vertebral body. Is it not? Right? These are the vertebral bodies. The whitish ones are the vertebral bodies, and the darkish one or greyish ones are the intervertebral discs. Okay. And you can see a central prominent one over here within the center of the body. That will be the spine of the vertebra. Spines of the thoracic vertebra. Got it? So this is the entire body of the vertebra, and this is the spine of the vertebra, and this is the intervertebral disc above and below. Getting it on? Okay. So in this manner, you can identify the thoracic vertebrae over here. Okay. And let us see the other structures over here. You can appreciate the scapula over here, scapular image over here. Could you able to see that? Right? This is also scapula. Could you able to appreciate it? This is the scapula. Could you able to see that?
Yes.
And this is the corcoid process. Okay, this is the corcoid process. And here could you able to see find anything? This is the corcoid process. Could you able to see that? Okay, this is the corcoid process over here. Okay. Okay. It's okay. We have already seen this in the superior extremity. Let us see the other structures over here. So we have finished the bony part over here. Let us focus on the soft tissues. Okay. First of all, let us see the trachea. Okay. Trachea, you can see that trachea is more deviated towards which side? Right side. Why? Because
For the
arch of aorta will be pushing the trachea towards the right side. See properly over here. The spines will be in the middle portion, is it not? If this is the entire length of the vertebra, spines are in the middle part. Right? If you see this is a darkish shadow, could you able to see tubular shadow over here? Could you able to see that? If you compare this entire vertebra, this is whiter in color, this is darker in color. Right? This is the tubular darker in color. Could you able to see that? So that will be the trachea which is deviated towards the right side. Could you able to understand? Right? So this is the trachea which is deviated towards the right side comparatively. It is not present exactly at the in front of the spines, but it is towards the right side of the spines over here. And you can see that this is the right sided area. This part is the right sided one, and this is the left sided one. Getting it or not? This is the right side of the thorax, this is the left side of the thorax, and the trachea is deviated towards the right side over here. Okay? So this is the trachea, so that will be entering into the, at the level of the hilum into the lungs. Is it not? The trachea will be dividing into two principal bronchi at the level of
T4 and
T4,
8%.
lower border of T4 vertebra, or at the level of sternal angle, you can say that. Okay. Okay. For example, this is the sternoclavicular notch. This will be the sternum, manubrium sternum. Is it not? Right. So here it will be dividing into two bronchi, principal bronchi, and will be entering into the lung over here. Right side lung, left side lung. Okay. And here you can see few whitish structures at the hilum. Could you able to see that? Okay. These whitish structures are like multiple dots and whitish lines also. Could you able to see that? Could you able to see that or not? You can see multiple dots over here, and also multiple lines. Could you able to see the lines over here? Could you able to see the lines or not? No? No? Okay, can I show you that? See here, could you able to see any lines within the lung substance? Within the dark color, could you able to see any whitish lines over here in this manner? Everybody could you able to see or not? Could you able to see the lines within the dark color lungs? Could you able to see that? These lines are the present, no? Could you able to see that or not?
Yes.
Okay. Could you able to see the lines over here now? Multiple dots are present and multiple lines are also present over here. Okay. These are entering into the lung from the hilum towards the lung. Getting it out? From the through the hilum, these things are entering into the lung. If you see properly, the heart is whitish in color over here, and the aorta or pulmonary trunk are also whitish in color, and these are also whitish in color. So what could you expect these lines are over here? What? Blood vessels, absolutely. So the blood vessels, nothing but the bronchial vessels and the pulmonary vessels will be entering through the hilum into the lung over here. So they will be carrying the blood just like the heart, isn't it? So whatever the lines which are going over here, these are the pulmonary vessels and bronchial vessels together. Getting it or not? And these whitish dots are hilar lymph nodes over here. Hilar lymph nodes. Okay. Lymph will be passing through the nodes. Is it not? Lymph will be passing through the nodes. So these are the hilar lymph nodes, and these lines are nothing but the bronchial vessels or pulmonary vessels. We can't differentiate, but these are the vessels. Getting it or not? Right? You can see these vessels are going over here through the lung, above and below. Right? So the blackish shadow is nothing but the air shadow, but the whitish shadow or whitish lines and dots are nothing but the lines of the vessels and the dots of the lymph nodes over here. Hilar lymph nodes. Right? So this is about the lungs and the bronchial vessels. Okay. And let us see the heart. Okay. This part is the heart. You can see that because it is filled with the blood, so the X-rays can't pass completely. Getting it or not? Right? So if any fluid is present, so the X-rays can't pass completely. To some extent they will pass. Getting it or not? So this is the entire heart, and here will be the great vessels of the heart. Let us see from above downwards, okay, based on the surface anatomy. For example, this is the sternocostal angle, is it not? Sorry, sternoclavicular junction over here, or joint over here, right? Sternoclavicular joint, left sternoclavicular joint. Okay, this part is the manubrium sternum. This part will be the manubrium sternum. You can't see clear, okay, because of this overlap. Okay, so you can see a convexity over here, one convexity over here. Right? And there is a depression, and again one more convexity over here. Right? So at this level, this part is a superior vena cava. Get it out? Superior vena cava. Because the brachiocephalic veins will be joining at the level of the manubrium sternum and becomes the superior vena cava at this level. Is it or not? Right? At the level of the manubrium sternum, both the brachiocephalic veins will join and form the superior vena cava at this level, below the manubrium sternum. So just below this manubrium sternum, this elevation or convexity is because of the presence of the superior vena cava. Getting it on? Superior vena cava. And below this convexity is because of right atrium. Getting it on? Because superior vena cava will be draining into the right atrium, obviously. So this convexity is because of the right atrium. Okay. And here, this small junction, you able to see that? Whenever the right atrium is curving in this manner, there is a small connection between the diaphragm and the right atrium. Could you able to see that? Could you able to appreciate that? Right? So, right atrium must be curving in this manner, but in between this curve and the diaphragm, there is a small white structure over here. So, what it can be? Inferior vena cava. Absolutely. So, if this is the superior vena cava, this small connection between the diaphragm and the right atrium is nothing but the inferior vena cava over here. Got it? Right? So, this is about the right side of the heart. Okay, and now let us see the left side of the heart. And you can appreciate that if this is a sternum over here, 1/3 of the heart towards the right side and 2/3 of the heart towards the left side. Right? So, what you can expect on the left side over here? So, this part will be obviously, because as we have seen the apex over here, obviously this must be left ventricle. Is it not? Keep the left ventricle just like that over here. And here you can see that. You can see an arch over here. Could you able to see that? This arch. Could you able to see this curvature over here? This curvature. Could you able to see this curvature over here? This is the arch of aorta. This is the arch of aorta. Is it not? Because we have seen the superior vena cava as this convexity. Just towards the left side of the superior vena cava, this part will be the ascending aorta and arch of aorta. According to the gross, if you go. Superior vena cava, ascending aorta and pulmonary trunk. So superior vena cava, ascending aorta and arch of aorta over here, and this will be the pulmonary trunk over here. Okay, I'll show it again once again. So this is the superior vena cava, and you can see this darkish, sorry, not darkish, it's bright whiter in color. Could you see that? You can see the difference. This is grayish in color, this is dark whitish in color. Okay. This part, this tubular part is the ascending aorta, and this part is the arch of aorta over here. Okay, getting it or So this is grayish in color, this is grayish in color, but in between these two, this tubular structure is more whitish in color. Could you appreciate that? Right? So this part is the ascending aorta, this part is the arch of aorta. Getting it or because it will be curving in this manner. Right? So this is the ascending aorta, here will be the arch of aorta. In X-rays, the arch of aorta is termed as aortic knuckle. Okay, these terminologies are important. In case of radiology, the arch of aorta is termed as aortic knuckle. It appears like a knuckle. Okay, so aortic knuckle. Okay. So this part is the aortic knuckle over here. So superior vena cava, ascending aorta, and this part will be pulmonary trunk over here. Getting it out? So this part is the pulmonary trunk. If you divide these three regions, this grayish in the place is the superior vena cava, this darkish one is the ascending aorta, and this part will be this again grayish in color. That is nothing but the pulmonary trunk. Could you imagine the pulmonary trunk over here? Okay. So just adjacent to the pulmonary trunk, you can get a left auricle, because left atrium is behind, we can't get it over here. So whatever the thing we are getting over here is the left auricle just below the pulmonary trunk, because adjacent to the pulmonary trunk lies the left auricle. Is it not? Left auricle associated with the pulmonary trunk, right auricle will be associated with the ascending aorta. Is it not right? So among this entire concavity over here, so this is the left ventricle. So this concavity, if you take, the upper part will be, upper 2/3 part will be the pulmonary trunk, and lower 1/3 part will be the left auricle, not the left atrium. Left atrium is on the behind. Behind these two vessels will be the left atrium. Okay. Only thing you can see is over here is the left auricle. Okay, not left atrium. Getting down? So left auricle, left ventricle, and pulmonary trunk over here. Understood or not? Understood or not? Right. So these are the three vessels which you are supposed to identify at this level. Okay. Let us see the relation between heart and the lungs over here. Okay. There is a term called cardiothoracic ratio. Okay, you are supposed to know this thing. You are supposed to know the aortic knuckle. You are supposed to know the cardiothoracic ratio. What is this ratio actually?
Episode 1 also. ল্যান্ডস্কেপ একবার নিচ্ছিস, পোর্ট্রেট একবার নিচ্ছিস, কত এটাই থাক।
See here everybody, cardiothoracic ratio. Okay, you have to measure the diameter of the entire thorax, all the way from here till here. You have to measure the diameter. Okay. So and you have to measure the diameter of the maximum diameter of the heart. For example, here is the minimum diameter of the heart. Here is the maximum diameter of the heart. Is it not? Here is the minimum diameter. Here, whenever it is reaching almost out to the diaphragm, it is the maximum diameter, right? So this maximum diameter of the heart should not exceed half of the diameter of the thorax. Okay, for example, if this is the half of the diameter of the thorax, okay, for example, if this diameter is, for example, 12 centimeters, for example, and this half will be around 12 centimeters, for example. Okay, so totally the thoracic diameter is 24 centimeters over here, and if you take half of the thoracic diameter, it's 12 centimeters, obviously. And the diameter, maximum diameter of the heart is 10 centimeters. Okay, this is the normal cardiothoracic ratio. Okay, so the diameter of the heart should not exceed half of the diameter of the thorax. So here it is less than the half of the diameter of the thorax. It is a normal cardiothoracic ratio. So this can be extended more than 12 centimeters in certain conditions. What conditions you can expect? Cardiomegaly. So the heart will be enlarged over here in this manner. Getting it out? So that will be leading to the diameter will be increasing over here more than the half of the thoracic diameter. Okay. And any other? Pericardial effusion. Is it not? The serous pericardium, normally thin film of fluid will be there. Maximum will be 300 ml. Okay. The maximum allowance will be 300 ml. So if the entire pericardium, nothing but a serous pericardium is filled with 300 ml of fluid, so obviously this will be expanded. The diameter will be expanded over here. So pericardial effusion, cardiomegaly in case of hypertrophy also, entire hypertrophy. Hypertrophic obstructive cardiomyopathy. It's a bigger term. But if the entire heart is hypertrophy, then also the diameter will be increased. Getting it or not? So cardiomyopathy, cardiomegaly, pericardial effusion are the common causes for increasing its diameter. Getting it or not? These are the pathological conditions. Okay. So if you see, this is this heart is about this much diameter, this much diameter. Over here, it should not exceed half of the diameter of thorax. I'm not even crossing the middle part, nothing but the vertebrae. Is it not? If you see,